Welcome everyone to our town hall meeting. I'm Andrew Schiff. I'm the CEO here at the Rhode Island Community Food Bank. Really happy that you're joining us this morning. We've been holding these town hall meetings since March to keep our supporters and colleagues updated on the food bank's response to COVID-19 and to be able to talk about the impact of COVID-19 on food insecurity in the state. For these town halls, we've often invited leaders of some of the best nonprofit organizations in Rhode Island to join us. And we thought this would be a perfect time to have them back to let us know what's changed and what challenges they're facing now. I'm really happy that this morning you'll be hearing from Kate Brewster from the Johnny Cake Center for Hope in Peacedale, Rilwan Feuerstein from the Community Action Partnership of Providence, Heather Strout from the Dr. Martin Luther King Jr. Community Center in Newport, and Kim Fernandez from Federal Hill House here in Providence. So you'll be hearing from all of them in just a few minutes. If at any point you have a question for me or one of our panelists, click on the Q&A icon at the bottom of your screen, type in a question, and we'll get to all your questions in a little bit. We know that COVID-19 has really damaged the Rhode Island economy. Now, unemployment is over 10%. Back in March, Congress directed extra unemployment benefits to folks who were out of work because of COVID-19. That was that extra $600 a week that folks were getting who lost work. But those extra benefits now have ended. And what we're seeing is that unemployed adults are increasingly unable to pay their rent, and are struggling to feed their families. The impact on the food bank is that more and more people are turning to food pantries for food assistance. Right now, we're serving 68,000 people a month. Before the outbreak of COVID, we were serving 53,000 people a month. So that's an increase of 1/3. And in response, the food bank has increased our distribution of food, the amount of food that we're distributing, by 1/3. That has its own challenges because over this period, we've seen food donations go down from supermarkets and food manufacturers. And also our big statewide food drives have been canceled. So to keep up with the need and make up for that difference, we've had to purchase much more food from wholesale than we normally would. The good news is that Rhode Islanders have been very generous. Individuals, businesses, foundations, all have been very generous so that we can afford to acquire more food, purchase more food, and keep up with this really high level of need. My worry is that we haven't seen this level of need peak yet, that actually as we move through fall and into winter, we're going to see the demand for food assistance actually increase. And that's one of the things that I want to ask our panelists about. So this is a perfect time to ask them to join me. Please welcome Kate, Rilwan, Kim, and Heather. Hey everybody.
Good morning.
Thank you so much for joining us this morning.
Morning, sorry.
That's good. So what I want to do is ask all of you the same question and then have you each answer. And you know, my first question is just, we've been in this emergency for 8 months. And I'm really interested in hearing what you've seen change at your agency, at your organization, and in your community because of COVID-19. Kate, why don't you start?
Sure. Good morning. As Andrew said, greetings from Peacedale, and my name is Kate Brewster. And I apologize early. I have to jump off of this call after my remarks. I've been invited to interview our chief of police candidates, which is an interesting task at this time. So I'm honored to be able to do that. Just briefly, Johnny Cake Center is a basic needs organization in South Kingstown. We provide food, financial assistance. We do a lot of community health outreach and provide other basic needs and resources. And we are a proud member of the food bank. We cover the towns of South Kingstown, Narragansett, and Block Island. And I think if you've heard me before, read some of our materials, you know, like many other pantries, that we had to really transform the entire organization over a weekend when COVID hit. For us, that meant having to launch our school vacation meals program early. And we provide a robust food program for kids who are in school and when they're out of school. We just completed week 27 at the end of September. We normally run that program for 9 weeks over the summer. So that was a huge strain on the agency. The community stepped up in a big way with donations of food and funds to allow us to do that. At the same time, I'm sure like many other agencies, we lost the bulk of our volunteer workforce. We normally have 150 volunteers strong who are helping us. They're the backbone really of the operation. And we lost probably 95% of those folks when COVID hit. So our entire staff had to pivot and shift and really do jobs that we aren't normally doing and support the food pantry. Of course, we had to take important steps and protocols to protect the safety of the staff and the health. We are still doing, and will continue to do curbside pickup. We tripled the number of deliveries that we were doing every week. We lost count at some point in the middle of December of how many deliveries we were making to folks who, were not leaving their house because of their health, who didn't have transportation. So that was another big drain on us or strain on the agency. And if you may have heard us talk about our trips out to Block Island, we were called by the local food pantry out there. They were under real stress trying to help workers who had not been able to start their regular employment during the season because it was so delayed. We made 3 trips out to Block Island with 2 vans packed full of food, thanks to the food bank. We were able to purchase some food from local retailers and wholesalers and went out and served over 200 people every time, all 3 times that we went. So we were doing a lot of things that we didn't normally do, but we were able to do it truly because of the community and because of the food bank's ability to step up at that time. I know that Andrew is going to ask the rest of you what we're concerned about going forward. So I want to just address that before I have to get off. Of course, we're in a university town, which makes things a little interesting. I think I'm starting to hear that our numbers are going up down in South County in terms of cases. So that's something that we're obviously keeping an eye on. But, things had calmed down a little bit over the summer. As Andrew said, we saw an initial surge of visitors. And then with all the government benefits that were put in place, it made a huge difference. People were receiving unemployment more than normally. They had extra SNAP benefits. We could absolutely see that had an impact. But now that those benefits in many cases have expired, we are starting to see our numbers climb back up. So that's a cause for concern. Of course, if schools close again or there is any type of shutdown, I'm really concerned about donor fatigue, about volunteer fatigue, and about staff fatigue. I think we kind of set the bar really high this last time around, or the first time around, and gave it our all. And if we have to pick that back up again, of course we'll do it, and we know what we're facing, but it's going to be tough. I think the community, again, was super generous. I know they will continue to be, but I do think folks are getting tired of COVID, and we know the worst of it is still potentially yet to come. So I want to thank the folks from the food bank who really, we couldn't do what we do if it weren't for them. And they show up every week with truckloads of food and make it possible for us to feed folks locally. So thank you, and thank you for having me this morning.
Thank you, Kate. We talk a lot about the fact that we've seen so many new families in the last 8 months coming for food assistance, people who never needed help before. But you're talking about even whole new communities like Block Island coming forward and needing help. So thank you so much for helping everyone on Block Island. Rilwan, tell us about the Community Action Partnership of Providence.
Good morning and glad to be here with all of you. Rilwan Facetun, Executive Director of CAP, and we are an anti-poverty agency, a large social service provider. We serve over 33,000 Providence residents through our array of programs and services. When I came to CAP 8 years ago as the Director of Program Operations, the pantry is one of the things in my portfolio programs to look at. It was a modest-sized pantry, and for us, it was a gateway to our other programs that we do. Our goal is to get people to self-sufficiency and get them on their feet. So we always looked at that program as a way to get them into our job training and the other programs that we have. Little did I know that that program would continue to grow year after year because of food insecurity. We went from a relatively modest pantry out of a community center that we were utilizing to, by 2019, one of the largest pantries in the city. What also was striking to me, and as I reflected today on what I wanted to say and where we are at this time of the pandemic, is at this time, Andrew, as you know, we were forced to close the pantry. So it seems like yesterday that we were going into the winter months. The building that we were in, the community center, was in disarray, and we needed to close as we went into the winter season, which is incredibly hard, being one of the largest pantries. And what that did was really help to magnify the needs that we were seeing, this in that one zip code, again, serving hundreds of families. With that closure was the reality that it was going to leave a void, and it was going to put a drag on the food bank network. So we were closed for over 3 months going through the winter. And we reopened in January, February of this year. And I know the struggle that we had in 3 months of moving to a new location, renovating over $10,000 and renovating that space, and all of the work that sister agencies in the network did, picking up that large volume of people that we left that needed services. So it speaks to the work of the food bank and our member agencies that jump in and pick up where we need to. That's the Rhode Island way. It's definitely the way that it played out for us. But the thing that really was powerful for us as we went into January and February, our staff continued to say, well, we're not seeing the numbers that we were seeing previous to it. So we need to do these big campaigns. And I kept saying to them, we're going to be okay. We're on a new bus route. We're more centrally located. We've got double the space. The food banks provided all these amazing refrigeration so we can double the capacity. Trust me, the numbers will come. The numbers will come. Just be patient. We've contacted all our families. We're going to stop picking up. Little did I know, less than 30 days later, we'd be in the middle of a global pandemic that was declared, and the volume of people that we would see. Never could I have thought that we would see the number of people that we had to serve. By the middle of the summer, not only had we reached capacity of what we had seen all of the year before, we were seeing 1,000 people a month come through our pantry, and these were unduplicated services that we were providing. And we've continued at an extremely high volume of service and providing needs to communities, not only in food, but basic needs. So for us, it's this an amazing turn to see this modest pantry go into, again, this behemoth operation. Like Kate, in the middle of the pandemic, or at the beginning of the pandemic, we lost 100% of our pantry staff and our volunteers. So we went from, again, being underserved to serving thousands of people and having no staff. So literally, as executive director, to our deputy, to our finance director, and every other staff, we shifted, we pivoted, and we were literally unloading trucks, moving boxes, and serving food when our pantry staff was not able to stand up at that time. So we are extremely grateful to understand where we've come from, to see the generosity of Rhode Islanders, the great support from the food bank, that we've been weathering the storm. But it truly is a storm, and I'm reminded that we're not done. We are still in the middle of a pandemic. We're still in the middle of doing unprecedented services and meeting this incredibly high demand and needs for those that are still struggling. So with that, I look forward to hearing my other panelists.
Thank you, Rilwan. I mean, it is such an important point that the public health emergency isn't over. We are still in the middle of it, and all the extraordinary things that CAP went through back in March and so many of our other member agencies did too, to switch things around so that you could maintain social distancing and keep all of the folks who are coming, the thousands of people who are coming for food assistance safe, keep everyone on your staff safe. It was a tremendous effort, and it continues. And it's going to continue for months to come, as far as we know. Thank you, Rowan. Heather, let us know about Newport.
Good morning, everyone. So I'm so happy to be here, coming from the Dr. Martin Luther King Jr. Community Center here in Newport. Right outside my office door right now, we have our breakfast program going on, which has served almost 9,000 meals since the beginning of this year. And we, like everyone else, have had to shift the way that we do things. We immediately on March 13th shifted everything to bag distribution. Since then, we have brought some things back into the building, including our client choice food pantry. The reason we did that was because we really believe in client choice. Dignity and respect are our top things that we believe our clients deserve. So, and we were seeing that the bags that we were distributing weren't necessarily things that everybody wanted. So we have really looked at our safety protocol. We're bringing in 2 clients into the building at a time, safely distanced. It takes longer. The lines are longer, but we are seeing very positive results from that. Thanks to the generosity of the food bank, I don't know how we would have been able to do what we've been able to do without that. We have been able to really focus our funding on fresh produce, and we have really grown our Veggie Day program, which is a program we hold every Thursday out in front of the center. When I came in this morning, that program starts at 10. There were already people lined up wanting to get fresh vegetables for their families. So that is in addition to our food pantry. And we are purchasing fresh produce from a lot of the local farmers in the area who have supported us time and time again. And now we are able to, thanks to the generosity of so many, in turn, purchase from them. So we're thrilled, and we're going to be doing that throughout the winter. We will bring that inside the building at some point when it is safe to do so. But I think our biggest success that we've seen this year is our mobile food pantry. We purchased last November a refrigerated truck, and I don't think we realized the magnitude of the impact that this would have to Newport County. So we've seen a significant shift in how many people come to the center, and so many of our clients that were coming to the center and were having to take Ubers and taxis and the bus to get here, we're now going out to their neighborhoods throughout Newport County. So Newport, Middletown, Portsmouth, Jamestown, and Tiverton. Our mobile pantry goes out to different neighborhoods in those communities, sets up what looks exactly like our in-person pantry on site, but we're doing it outside safely in communities under a 10. And we've gone out over 100 times. Last year, in 2019, we went out 33 times. And already this year, we've gone out more than 100 times to different neighborhoods. And we've seen a huge shift in how many people are coming to that program. And we are proud to be able to now provide meat and eggs and milk and all of the things that people get when they come here to the pantry. So that has been a real change to our community, and the feedback that we've gotten from that has been remarkable. The biggest thing that I've seen from the people that we serve are 2 things. One is fear. People are really afraid. They're afraid of what's to come. They're afraid of what's in front of them right now. But also, I've seen gratitude like I've never seen before. It's not rare for me to sign a thank you note to a client who sends us a $5 donation because they're so grateful. And to me, that's worth $1 million. So I see such gratitude from the people that we serve. And we've seen over 1,000 new clients to the center who have never come to the food pantry before. And that's only going to rise. Newport is a tourist destination. And so the summer was okay. I think a lot of people we're doing okay in the summer, and now we're starting to see that go back to where it was in the spring. So we're very concerned about that. Here at the center, we also have education programs. We have a preschool and an after-school program that shifted to an all-day distance learning when needed. And we also have community programs. So those are the things I want everyone to know about the center.
Thank you, Heather. The really important that one of the last points you made about that the hospitality folks, all the people who've been working at restaurants and just getting by with colder weather and end of vacationers, we're going to see more layoffs, and we're going to see more people who just can't find work in industries that they've worked in for years. And I just want to say that as you point out, that mobile food pantry just ended up being so important. People didn't want to travel. People didn't want to have to get on a bus, but they were running out of food. And that program in Newport was able to reach out to so many people. So it really was very lucky that you had that in place, that you had worked on that so hard to make that program happen. And now it's a critical part of the services that you provide. So thank you so much for that. Kim Hernandez, now we want to hear about Federal Hill House.
Wonderful. Good morning, everyone. Kimberly Fernandez with Federal Hill House. We operate 2 food pantries, one in Federal Hill and another in Olneyville. And I was actually checking the stats last night. Our zip code still remains the zip code with the highest number of positive, or highest percentage of positive COVID cases in the state of Rhode Island. And so that's on top of everybody's mind that comes through the pantry. Like the other centers, we converted right away to grab and go. And we'll talk a little more in the next section when we talk about challenges, what that might look like in the winter and those challenges that that come along with that. I also agree with the other my other colleagues around high early demand, people being a little bit more okay over the summer, and seeing a creep up back now that the fall has started and there's so much uncertainty around stimulus packages that may or may not come, unemployment benefits that may change, the election, the social unrest, the going back to school. Do you go back? Even if you could go back, maybe you can't because your kids can't go back. And so I think families are making a lot of hard decisions right now, and relying on food pantries to fill some of those gaps. One of the things that has changed for us since March, or I think I was on here maybe in April, I'm trying to remember. We've added 2 community health workers to our team that operate out of the food pantry. And that's been a really wonderful way to provide support around COVID-19 information, testing. We also can provide some isolation and quarantine support. So things like deliveries. And like Rowan said, this is also a way to let people know about other services, either within Federal Hill House or within the community, because as we always say, nobody's just hungry. So I feel like we've developed our capacity to do that more than we were ready to in March. A lot of our volunteers have come back. In the beginning, like my colleagues said, it was staff. We did get some sort of younger, healthier volunteers through the Emergency Management Agency. Originally, some of them ended up staying, and we've had some of our folks come back. But we are worried as flu season hits and the winter comes that that might be a challenge moving forward. We're also in a community with a high percentage of undocumented folks, so those families didn't benefit from the unemployment or some of the stimulus checks that helped other people. So they continue to come to the pantry. At our Swiss Street location last March, we had 475 visits. In September, we had 1,076. So that's really increased a ton. In Olneyville, since March, we've seen 1,787 new guest visits for a total of more than 37,000 visits during that time period. So, I think the demand continues. I think, who said this? People are stressed and concerned, and then there's also pandemic fatigue going on. So it's a tricky time for everybody, and we're just grateful for the support of the food bank to help us do the work that we do.
Thank you, Kim. Why don't we move on to the question about the challenges that we're going to be facing in the months ahead. I mean, you already were just talking about the fact that we've all been so worried about the families who have had COVID and they've had to quarantine. When families don't have the ability or the funds to be able to order from Peapod or get a delivery, they're quickly running out of food. And you were able to deliver, you were able to help those families who are in dire need and sick. And I'm just so worried that one of the many challenges ahead is that experts are saying that COVID-19 is going to be even more widespread as we go into winter. But go ahead and talk more about the challenges that you're worried about.
Yeah, I agree. I think, we were able to do a lot of deliveries early on. In the summer, more people felt comfortable coming out, and now we are working on upping our capacity to continue deliveries and expand them. Also, I would love to go to a choice model. I do completely agree with Heather that people should be able to choose what they like, what food they like to take home. It's a question of dignity, and also we want them to use what they take, right? But that's really difficult with the space that some of us have. Our Olneyville Food Center is quite small and our lines are outside. Our volunteers take up all the space doing the pre-bagging. So, we've put out grants and seeking funding for tents and heaters and things like that, and looking to see what, how we can still serve people safely with the weather that's coming up and maintain the required social distancing. So I'm a little bit worried about that. And just like you said, being able to have the capacity to keep supporting the families that need it. I will say, and I think I said this the last time, but shout out to the food bank for their increased support. Being able to use our funds for staff and logistics rather than purchasing food, having increased deliveries from the food bank. There's no way we would have been able to pick up the volume of food that we've given out without the food bank increasing their delivery. So I really appreciate that. And that's thanks to donor support that allows you guys to do that. So hopefully that continues.
Absolutely. Heather, talk a little bit about the months ahead and what you're worried about in Newport.
So as I said earlier, I am worried about the people who work in the hospitality industry not being able to afford to survive. We are also concerned about the governor's orders on evictions. That will end, I believe, at the end of the year. And there are a lot of people who are going to find themselves in a situation of being homeless. And there's also already a major shortage in shelter beds in our state. And that's going to just escalate that. The drop in support, we've seen such tremendous community support, but is that going to last? I mean, we've already seen a significant drop in that over the past couple of months. And however, our costs are not dropping. Our costs are only going up. So I worry about that. And somebody talked about the undocumented community. We were part of the We Are One Rhode Island distribution of $400 debit cards to people in our community who did not qualify for stimulus money. And that has really opened our eyes to how much need there is in that population in our community. And I really worry about those people and who are not receiving any of the support, federal and state support. And I worry about food costs. You know, even though the food bank has been tremendous, we would not have been able to do what we've done without the support of the food bank and giving us all of this food at no cost. But even with that, we've spent almost as much on food so far in 2020 as we did in 2019. And I hope there's not a day where we have to go back to purchasing through the food bank, but I know that there will be. I worry about how we're going to be able to do that and continue to serve the numbers that we're serving with the dignity and respect that we've been able to serve those people, and providing healthy choices, because everything starts with health. If you're not healthy, then the rest of it falls apart. And we all know how it feels to be hungry. When you're hungry, nothing else matters, because you can't focus on anything else. So I worry about a lot, but I do have a lot of hope as well, because I see time and time again, our state, the food bank, our community come together and help one another. And I just think we have to keep our hope.
Absolutely. I think that the number of people coming for assistance will likely increase. We talk about COVID, but also there's just every year we see this pattern through the fall and winter, because people suddenly have a cost of heating, and they got to pay the rent, they got to pay the utility bill, and next thing you know, there isn't enough money for food. Rilwan, you are helping people with the full spectrum of needs and financial problems that folks are having. Tell us about what you're thinking is going to be the demand in the coming months.
If I allowed it, it would terrify me. It's the biggest level as an executive director of angst that I have across all of our programs. These uncertainty of going into the winter months and understanding or figuring out how we're going to yet again have to pivot. For us, we've got this incredible building, this incredible space that we moved into and renovated, but we worry about ice dams and icicles forming over these long lines. And so we're actively thinking now about how we're going to move to an outdoor pantry model, just because of the sheer amount of people that we now see coming to the building. Previously, we would have invited them into our gathering spaces and provided, something warm while they wait in the cold months. But now, because of social distancing and being in Providence, as Kim said, we have the highest index of positive cases, and making sure people are safe, that we can't provide that level. We're in the dignity business at CAP and helping people to feel secure. And we can't provide those basic staples and security that we want. So again, looking for heated tents and spaces to pivot our programs because they can't gather in our building spaces is deeply concerning. The other thing that is really concerning is, again, so many of us have staff fatigue now. We were essential workers, kind of just like our doctors and nurses and firefighters and first responders. We never closed. We've closed one day minus holidays in this entire duration. So staff are tired. Unfortunately, our volunteers, many of them, because of children going back to school and virtual learning, we have no volunteers currently in our pantry operations. So we had a staff person get injured last week, again, just doing more, trying to do everything they can to make sure that we're meeting these needs. So we've also had to look at being innovative. In addition to the actual pantry, we're now distributing food to our seniors in the program that can't congregate or come. So our hot meal set are no longer operating because of COVID. So we're now going overnight to a delivery program where we're delivering over 500 meals a week to seniors. And then on those Fridays, we give them commodities so that they're okay over the weekend, in addition to wellness checks. So we didn't budget for it. We didn't expect it. So we are actively even hiring now for 4 positions in our pantry area because our volunteer base is totally dried up. So again, as we look financially, we're committed to the work, we're invested in it. But again, that wasn't part of the strategic plan when we came into 2020 or operating budget. So donations and support have kept us afloat. But there's some tough days ahead, and we were making really tough decisions about how to balance and prioritize the needs of our community. and it's a little daunting. So we hope again that donor fatigue won't set in. But again, we definitely could use more support, just in volunteers or those that are able to be there, in addition to the positions that are posted. So if anyone's looking for work and wants to work, we've got 4 positions posted right now in our pantry and delivery operations to help get us through these difficult months.
Thank you, Wilwan. You know, Heather, you mentioned we have to keep hope, and you know, this is what makes me hopeful and inspires me to hear all the things that all of you are doing to increase the amount of people that you're helping, to add new services, to change your program so that they can accommodate more and more people. You know, thank you for everything. It is amazing what, as a network, all of us have been able to do together over the last 8 months. It really is inspiring for me. And I hope it is for the folks who have joined us this morning. Now, you know, I'm glad to turn it over to Lisa Roth-Blackman, our Chief Philanthropy Officer, to see if there are any questions for our panelists.
Good morning, everybody. So far, we have a question that all of you have touched on in one way or another, but I wonder if you might want to give a little more detail even. The question is about delivery to people who can't make it to the food locations and might be shut in their homes. And I think in some ways, you've all been talking about that, whether it's a mobile pantry that might just be going closer to the community, or deliveries of the senior meals that you can no longer provide in your location. Rilwan, maybe I'll start with you. How do people sort of find out and get signed up for that? And then Kim or Heather, if you have anything to add, it seems this is an area of interest.
Absolutely. We have folks coming to our website every day, dozens of folks looking for service. We've been really focused on the geographic area that we do. The food bank has a great network, and geographically we've kind of broken up that work, but we'll help anyone that needs it. So we take emergency recipients all the time that come in to be able to get them through, get them referred to a partner agency. But they can come right to our website and do our basic intake, which opens them up to all the services, including the food insecurity programs that we do. I think Heva was ahead of her time. We also went and purchased a mobile food truck. So they've been on back order for about 3 to 4 months. I think everyone in the country is trying to figure out how to do that option. So kudos to you for being ahead of the game. Ours actually comes in this week. So we've been for months, you know, doing out of a 15-passenger van, delivering this again, hundreds of meals to our seniors in high rises and individual homes. But we're just limited by the capacity. You can only deliver as much as you can hold and as many people that can bring it. So, but we're always open in taking requests and referring people as appropriate to services. No one is turned away. Everyone walks away with food if they call on us.
And do you worry about folks? Do they have? You're saying they're coming to you mostly through the website. Is access to the internet or technology an issue? Or are some folks not able to get in touch that way, and they're calling or somehow otherwise getting word to any of you that they need help and they need a delivery?
Just to clarify, we're getting a lot through the internet, but there is a digital divide. They can absolutely call into our number as well, and we'll refer them and get them connected with our pantry. Word of mouth is always the biggest thing in our community. We service people really well. We give them high quality food and other basic needs, so they're coming in through all of the vehicles available to them.
Yeah, I would say our delivery is mostly focused on seniors. We haven't built the large infrastructure yet for any sort of mobile pantry or delivery to the general public. It's mostly been seniors that were part of our Central Providence Healthy Aging Network, referrals from some other community health workers for people who needed isolation or quarantine support or had longer term health issues. So we've been able to add some of those, but that's definitely an area where we're looking to build capacity.
And in addition to our mobile pantry, which I talked a lot about, we also have a program that's called Food to Friends. This program is for homebound people. And to date, we have 164 homebound clients, and we've made 1,154 deliveries so far in 2020. And these are deliveries that we usually do this via snail mail because of the digital divide, also over the phone if needed. And we let clients select what they would like, just like we do in our in-person pantry, but we do have volunteer shoppers who shop here on site and then go deliver things to people's homes. So that is the Food to Friends program.
Great. There's a question which, Andrew, maybe I'll start with you and then let everybody else address it, is what support, if any, do you have from local government?
Well, there was tremendous support from the local cities and towns beginning in March. And, it was different in each community. The effort was overseen by REMA, Rhode Island Emergency Management Agency, but they went to Providence, they went to Newport, they went to each city and said, tell us the population that you're most concerned is not going to be able to get food. Let's figure out how to provide food assistance. And in Providence, there was just a tremendous effort to make sure that, in particular, homebound, frail seniors were able to get the food they needed when they couldn't and shouldn't leave home to go shopping. And then all of the families who were quarantined. In Newport, I know, and Heather, you can talk about this, there was a big effort at the Pell School to provide extra food assistance when families were also coming to get meals that were provided by the schools. So it was different in each community, but they, some of those efforts have scaled back down, which is, I think common in an emergency where you think, well, we're only going to be in this for a few months. So that's sort of the, the lookout is a few months, and then you start to scale back those emergency programs. But the people who were getting assistance through those programs that were put in place in March, April, and May are often still in need. And then it falls on everybody who's here today to make sure that those folks are continuing to be served. But Heather, I'm interested in what you saw happen over at Pell School, and then what has happened since that has scaled back.
Yeah, so we here at the MLK Center, about 2% of our overall budget is from any kind of government, state or municipal support. So the rest, the other 98, 97, 98% comes from grants and individual donors and corporate support. And one of the things that we've done, which to raise money during this pandemic, is to have mobile food pantry sponsors. So it's $1,000 to sponsor a distribution of the mobile pantry, where we go out to a neighborhood. We set up our, on-site mobile pantry shelving, and we do it just like our in-person pantry. And we have signs, and we do social media marketing to promote whoever the sponsor is. We've had some families sponsor in memory of loved ones. We've had some corporations sponsor. So that's been a really great way for us to be able to continue doing what we're doing. I know that was part of the question. As far as the Pell food distribution, so during the real height back in April and May, Pell School did have a food distribution where they were having people drive up and, again, putting bags of food into their cars. Once that slowed down, there was a lot of conversations going on. So it didn't just stop. There were calls to me, and we talked about, are we ready to take on the overflow? Because there was that real quick spike up in numbers. And then as that started to drop down, we were in a position here at the center where we could take on that many more people. So, and I know that any of those emergency programs are ready to shift back into reopening if needed here on Aquidneck Island. I hope we don't need them, but if we do, they are ready.
Kim or Rowan, local government support?
Kim, go for it.
Okay, I would say most of our local government support actually comes through the Community Development Block Grant COVID Response Program, which is, federal funds that seem to have moved a little more quickly than some of the later CARES Act funding that, we can apply for now, but we have to use it by December. So I would say that the support has been, through that for our expanded hours, for an assistant for one of our pantries, partially funding the community health worker. The city of Providence has also helped with volunteer recruitment through their Providence Emergency Management. And they provide some things like hand washing stations outside of our pantries. It's not always easy to know how to access some of that support. The mayor actually visited last week. Let me know what you need. I'm like, okay, get a pen. So I think there's support, but I think that, I think in Providence anyway, we did a pretty good job of coordinating. I mean, there were calls, there were food, between Meals on Wheels delivery, the food bank, the food pantries, what was happening with the rec centers and schools. But it's not like we got, oh, here's everything you need. But they're supportive.
I think everyone's trying to figure their way and trying to figure out how to best be allies in the work. On the local level, we didn't get any increases in our food funding, but what we did get from the city as part of CDBG was $100,000 in rental and mortgage assistance. With the challenge has been through a lot of these programs as they've come through is the extra level of bureaucracy. So the paperwork demands and everything else are a lot higher than they generally are for programs. So it makes it harder to get the money out the door. But I do want to mention that we do have those services. So for everywhere you can be supported around rental and housing assistance, that opens up food for your family and not worrying about what meal you're going to eat or not eat. On the state level, we also have money that we're hoping will be opened up soon that will allow us to infuse some new dollars in the work that we're doing as well, that were provided through the Federal CARES Act that's taken the state a while to get out to us. Again, we work as a reimbursement agency. So again, we put the money out first and then they reimburse. And we've got a really large outlay that's out right now that we need to be able to draw down to so we can continue to do some more good work. But they've been great partners, from PPE to helping us to be able to look at guidance and how to restructure things and make sure that safety has been paramount during this work. So we'll continue to work and assess on how we can do these more efficiently and get more help out to people quicker is what my hope is.
Great, thank you. Well, you mentioned PPE and we did have a question about that. So it's a good segue as how are you guys all managing the needs for your staff and clients who may need masks or other supplies for addressing COVID? I know the food bank has had some donations that have come out, but I'm wondering how that's going on the ground. Roland, maybe we'll start with you this time and go around.
We're in a really, really good place. So again, as soon as we knew or started seeing inklings that this could be a real issue and things like masks were going to be recommended by CDC and other providers, we were part of that long backlog of people that were back ordered for months and months. And then the floodgates opened as more manufacturing ramped up. We also have a really great partnership with Aurora Hez. We're a lead for the Hez in our area. So we actually have a mass distribution box outside of our main building. So people can literally come, open up that box, take as many masks as they need, and we replenish it as soon as they're gone. So we're in a really good place to go through the fall. And I think through the uptick that we're going to see as we're kind of in the second wave, that at least through mask and basic precautionary PPE, that we're in a good place. We weren't that way so much in the beginning. I think I reused the same mask for 2 weeks in the beginning of the pandemic. But it's been really fortunate that we've really stocked up and planned. We didn't plan the budget for it, but we have them now.
Great. Kim or Heather?
So we are really doing well with PPE, and we just got a donation of, I believe, 6,000 masks from Bank of America last week or the week before. So we should be good for a long time. I would say that's honestly one of the things I'm not worried about in all of this is having enough of that. Other than disinfectant spray, the aerosol disinfectant you can't find anywhere, and that is really convenient when you need to do a real quick cleaning of something, but I just don't think that, I'm sure that's something that nobody's seeing, but we do have disinfectant. It's just not the type we would love to have. So if anybody out there has a stash, please send it our way. But no, I think we're doing well in that department. I'm not worried about that.
Great.
I think I got an email yesterday from Staples that there's no spray that I had ordered. It's like they let us order it, and I don't know, somehow it comes to me. I would say the same. I think for me, it's just some of the early masks that came in were not the best quality. So we're looking for, anytime we order or work with a donor, or we get masks through the heads as well, just making sure they're ones that fit on people's noses, that we'd like to have more reusable ones from time to time. We do get them, and I can't even tell you where they all come from, but we do get them. And oftentimes we put them in little baggies and put them in with our grab and go bags for our clients. We've had them ready for people who come up, but most of our guests do come with masks already. So if we give them out, it's more for an extra. I originally thought that there'd be long lines of people with no masks and we'd be handing them out, but people have been pretty good about it. Now, are they reusing the same one multiple times? Is it totally fitting great? Not necessarily, but not everybody has grandma making her or mom making her own mask. So
Great. We have a question about how each of you fundraise for needs like purchasing food or other services like money for gift cards, or maybe how do you decide whether to buy gift cards, or are you being given those versus purchasing food and supplementing what you're able to get from the food bank? Heather, I'll let you start because you actually talked about those gift cards, and then we'll go around.
Yeah, so I would say if you can imagine it, we're doing it. Reaching out to individuals, applying for grants, applying for sponsorships, a variety of different revenue sources. And I think we're all having to be really creative. I know that we had our signature event, which happens in March of every year, canceled. And that was, our goal was $200,000 in revenue from that event. So we've had to shift and try to be creative with other ideas, which is how the sponsoring of the mobile food pantry distribution came up. But I think right now, I'm sure I can speak for everyone, that the generosity of the community over the past 8 months has been incredible. And so we haven't had to worry as much as I would have thought about that, but I've seen a significant drop in that over the past month or two. And now I'm really starting to worry about that. So we're going to have to be extremely creative. I think people are starting to get burned out of the Zoom fundraisers. So we're trying to think of what are we going to do come the spring and summer to make sure we can continue doing what we do.
Kim or Rowan?
I think for us, we are just as creative as we can be. Like I said, we went from manning the trucks and delivery to becoming full-time grant writers, all of our senior staff. So writing for every grant opportunity that's out there to bring in funding. I can really say the philanthropic community stepped up in a big time over these first 8 months to really help us to get through, from our community foundations to corporate sponsors, and allowing us to do it. As Heather said, we've not been able to do our normal fundraisers and income generating things that we normally do that keep our operations and the lights and everything else on. But that earmarked this food insecurity money or basic needs money that's come through has really allowed us to continue to work at a high level in providing needs. Without that, it wouldn't be possible. So we've been really, really happy to see Rhode Islanders step up in every way, and we're hoping that's going to continue as we go through the duration.
Kim, anything to add?
I think I'm a little, we do get a lot of government support for some of our other programs. We have federally funded senior programs. We do have childcare, so fee-based programs, and some other city funded programs and state funded programs for our young parents. So as a portion of our overall budget, our fundraising is pretty low. But it's definitely an area that we're trying to grow, and I think it's the people power to get it to, to keep launching it and growing. Getting the word out about our work isn't always easy because we're so focused on doing the work. And as Rowan said, I mean, writing grants after grants after grants without a ton of internal capacity. I think we're a little smaller than my colleagues here, and but we're working on it. And as people get to know their pantries and our other programs, they want to support it. It's just a matter for us of having the time and the talent and the leads to get more folks coming through the door and or the virtual door and deciding to support our work so that we can go beyond the basics.
Great. And we have a question about how you advertise for volunteers. You've all talked about the need of volunteers coming and going as the pandemic challenges have been out there, and Rowan even looking for staff to fill in some cases. Do you advertise through Volunteers in Action or other sites? How do you let people know about what your volunteer needs are?
I can't fully answer that as I've got an amazing communication staff. I think we've done everything but smoke signals at this point and did skywriting in the sky. Every avenue that we know, from social media to volunteer areas, REMA, we've put it out. And it hasn't been that folks haven't wanted to step up. Everyone's needs are unique, and we understand that. It's been particularly hard with the virtual learning and people doing hybrid models that is requiring more able-bodied individuals that would normally want to serve to take care of their kids, which should be their first priority. Next to serving and helping their neighbors. So maybe as schools reopen or folks are able to kind of navigate whether they've gone through their own COVID situation or not, we'll see that uptick. But we advertise everywhere we can. Every breath that I talk about, if someone's willing and able and healthy, we would love to let them serve with us and come and help their fellow Rhode Islanders.
And so we have not had to advertise. We definitely have people calling and emailing us each day wanting to come and help. And some of our volunteers have returned from before COVID began, but we've also gotten a lot of new volunteers. We do have a volunteer coordinator who does a tremendous job, and also our marketing person does a tremendous job putting out the word out there if we ever do need help. We have a following, a social media following that's very large, and it seems to do the trick anytime we need support like that.
Yeah, I think our we were very lucky to convert some of the original volunteers who came from the Providence Emergency Management system into, they very quickly no longer signed up through them and signed up directly to us. So I think what our focus has been on making sure the volunteer experience feels really meaningful, so that they keep coming back. Even though the group is relatively small, whenever I visit, I always see the same people. So, I mean, there are people who, like, it's their job. You know, I'm here on a Tuesday, I'm here on a Thursday, here on a Wednesday. Oh, she comes every day, you know? So we have a small group, but they're pretty consistent right now. In the pre-COVID at Swiss Street, we had a lot of partnerships with schools, maybe with kids with disabilities, or you know, internship type programs. And so that was the big shift. Those schools would no longer come out in a group. So it might be a supervised group of young adults with a couple of teachers. And so they would do, so Swiss Street, we really had to rebuild the volunteer base from the beginning. Our Olneyville Food Center, I think it was more word of mouth, and people did come back. So we've been fortunate.
Thanks, everybody. A couple of you mentioned events, and I did just want to note today would have been the food bank's Empty Bowls event that we've been doing for many years, and clearly we had to cancel that due to the pandemic, but we have been promoting on our website list of restaurants and artists, and we're trying to pay it forward and ask people to go out and support them and eat outside if you can, or get takeout, and start your holiday shopping with some of the artists who have supported us for all these years, because we really want them all to survive and to be there when we can hopefully gather together again sometime in the future. And I think I wanted to also just let everybody know to watch your email and our social media, because we will be hosting another speaker in a couple of weeks on November 12th at 9 a.m. We've invited Ellen Teller from the Food Research and Action Center in Washington, D.C. They're the main sort of hunger advocacy group around the federal nutrition programs in D.C. And she'll be joining us to talk about the impact of the election on the federal nutrition programs and where we see things going and where there are opportunities or challenges going forward. So watch your email for more news about that, but save the date for November 12th. And we want to thank you all for coming this morning. It's been a great conversation. Thanks to our panelists. Great work you're all doing in the community. And we hope to see you all on the 12th. Thank you very much. Goodbye.
Thank you.
Thank you, Lisa.
Thanks, everyone.